Pam, can you hear me?
Yes, hi, Dr. Schubert.
Yeah, I'm not
I
sure why
can't,
the
but I can
video's
hear
not
you.
working. Let me see here. Mm,
Hi, Marcia.
hmm, I can't get the video to work.
Hi, Barbara.
There, the camera's working. The camera's working. All right. Well, I can't get the video to work, but you will get to stare at my ugly face at least. Let me see if I can. I'm not sure why it's not working. They did do an upgrade on the weekend, and they may have gotten rid of it.
Hmm.
I had to readjust the workspace at work for my office format, so maybe that's what happened. Well, anyway, you'll have to picture me in your mind.
Yep.
Um, we got a couple minutes here. Um, so I'll share some good news from the Schubert household. My son got into Georgetown Med School this morning,
Yay.
Wow,
so
that's great.
Excellent.
I have to be
Congratulations. That's
very
awesome.
excited about it. So he was over the moon today and
Great.
called me in the middle of the office, and he was quite excited. So
Awesome.
someone to
Wow,
carry on work in the medical field. So I think that'll be good.
Excellent.
Um,
that's awesome. Do you know what he
and
wants to do, like for a specialty or anything, or is that still down the road?
nothing yet. I think he just wanted to get in, and so he's pretty
Yeah.
darn happy now. So, um,
So where did he do his undergraduate?
so he went to Franklin and Marshall.
Ah,
So
yeah.
one of the few schools that's older than Georgetown. So it's about 5 years older than Georgetown. So he beat me on the undergrad for older school. And I think it is almost 6. Let's see. So it should be a short meeting. It's going to depend on how much we discuss our federal budget cuts, I think is going to be the big thing. And it's 6 p.m. So it is 6 p.m. And is Elizabeth going to be here?
No, she couldn't make it because it's school vacation week.
Oh, that's right. Okay. So then let's open up the meeting. This is the Board of Health meeting. It's a virtual Zoom meeting, Tuesday, April 22nd, 2025. This is a virtual meeting, so all votes will be a roll call vote. There will be available access to the public for various locations, PC, Mac, iPad, iPhone, Android, on the website and the URL listed on the town website. So I'd ask for, we open the meeting. So those who are present, Marcia Lewis,
Marcia Lewis here.
Paul Schubert here. The meeting is open. We have a relatively short agenda. The first one is approval of Barbara Reardon as an agent to the Board of Public Health as a soil evaluator. So I'll introduce Barbara Reardon. You have the floor.
Hi, folks. Thank you for having me here tonight. I'm excited. I've been talking to Pamela a little bit, and I've done this kind of work before. I love being out in the field, love being with other people. it's a perfect fit for me. So hope to do a good job for you folks.
Yep,
And-
and Phil, who we loved, worked for Cohasset for years and years and years. He was the one that recommended Barbara, and I know the town of Situate plans to use Barbara as well, and so yeah, her resume is awesome. She's a civil engineer as well as a former health director, so she's got it all going. So it should be good.
Excellent.
Excellent. Well, if we get the votes, then you'll be on board. I'll ask for a motion to approve Barbara Reardon as an agent to the Board of Public Health as a soil evaluator. Is there a motion?
Yes, I'll make a motion to approve Barbara Reardon as an agent to the Board of Public Health as a soil evaluator.
I will second the motion and ask for a roll call vote. Marcia?
Marcia Lewis, I.
Paul Schubert, aye. The motion carries and is approved. Welcome aboard.
Thank you very much. I'm looking forward to it.
Excellent.
Barbara, I do have to tell you one thing. So we had one else scheduled for Doan Street. They just canceled today. Sorry about that.
Oh,
But-
okay.
I know, but I'm sure there'll be more on the books pretty soon. Like I said, we usually do like one a month, so there should be something coming up to replace that one. So
Sounds great. Thank you.
sorry about that. All right,
If
thank
you don't mind, I'm going to stay at the meeting and see what's going on with federal funding because I've been dying to know what's going on with federal funding.
Okay, well, I'm glad
Sure.
you're going to join us. So next up is the federal budget cut impacts on local health. Just a little background. At work, I work through the Mass General Brigham, and we've seen cutbacks at the federal level for a lot of grants and studies at the pretty much highest level for cancer and infectious disease and all the things you can imagine. I suspect this will trickle down from the study point of view at the university level down into the local level. And a lot of the local grants are federal grants supplemented by state grants, and then you'll have the local municipalities adding their level of input. I think that my biggest concern is going to be going forward will be whether or not the federal government will support, which has been a success for 50 plus years, vaccination programs for the population statewide and nationwide. So I'll turn it over to Pam as well.
Well, since we're talking about vaccinations, I actually turn it over to Joni because they're really expensive. But the reason why we can do like flu is because it is subsidized and it makes it affordable. Like once they stopped subsidizing COVID, we'd stop doing COVID because it just got to be too much money. We couldn't come up with it all. So Joni, you know more than me about that.
Are you there?
Joni? I can grab her. She's actually here with me in the other office.
So
Hey, Joni.
the other thing which is out there currently is, as you know, there's a rather large measles outbreak in West Texas. And I've been kind of following it since the original start of a few months ago.
quit.
It has expanded, and there's another additional, I think, 20 cases reported this afternoon. So they're into the 600 range for active or cleared measles cases, which is the largest, I think, in about 12 to 13 years. So Joni, all yours.
Oh, great. I apologize. My computer said it was unmuted, but you weren't hearing me. Nor was my camera working, so I'm 0 for 2. I've read everything Marcia has sent along. You know, it is scary to think that if they go with a certain model that flu vaccines, may not be covered by insurance. It's people are already, it certainly noticed a decline in, how many people took vaccines this year. We ordered, I think, 500, which is typically what Mary had ordered in the past. I think I have at least 200 left. So it's literally cut in half. And that's something I'll work on this week. I have to confirm my flu order for next season already by like next week. So, I got to look at, we do privately purchase it and it is expensive, so I don't want to take too much and then we end up losing money. I mean, not that it's about money, but in a sense it is. So we'll have to look at that a little closer this year. But yeah, it's scary to think that that's the path they're kind of looking at right now. Not only flu, but, could be multiple vaccines.
So Joan, how do we publicize the flu vaccine campaign in Cohasset?
It's on social media, it's
Mhm.
on the town website, it's, when the flu clinics are getting closer, we use the digital signboards in town.
Yeah.
So kind of use all platforms.
And the
Yeah.
customers are primarily older people.
Yeah.
And so they really do push it at Wilcott Commons and let
Good.
people know and.
Yeah, I mean, I tried as hard as I could this year. I held as many clinics as I could,
You
I
and you
could-
traveled to homes and,
Oh, yeah.
the
Yeah, plenty of
60
home
Elm
visits
Street
and I did senior housing or elderly housing, whatever it's called down here. But I don't know, it was a lot different this year than what I'm used to. When I worked in Hull the previous years, we did, in one day we would do 500 down at Endless Summer and, we were over 1,000 we would do, so it's different.
Hmm.
I don't know.
So are they given in the schools or not at all?
So I provide vaccinations for the staff at the school. I go to all the schools and do the staff. And I let them know it's available. That's up to them to decide if they want to take on that role of vaccinating. They have enough going on over there at the schools.
Mm.
But it's offered to ages, I don't know, I think it's 8 and up at our clinics. So there's certainly multiple opportunities, for children to get it as well.
So we saw this, this flu season, that was one of the interesting numbers of patients that we saw. The flu vaccine matched, so it was a good match. But even in Massachusetts, there was a drop of about 20% of the pediatric population, so 20 years of age and under, that were getting the flu vaccine. There was a very good study looking at Japan, and Japan probably about 10 to 12 years ago initially was giving flu vaccines to the pediatric population and the elderly population 60 on up. And they felt that the kids probably will do fine with the flu, which they found out it wasn't right, but they stopped giving vaccinations to the pediatric population. In the following 3 or 4 years, they saw the elderly population have a dramatic rise in flu admissions, deaths, and complications from flu infection, despite being at the same level of vaccination as it was pre-pediatric stopping of the vaccine. They turned around their recommendation and began vaccinating the children again, because the children were the ones giving it to the parents.
Right.
The parents would basically be well enough to go to work, and the grandparents would come to take care of the pediatric population. They would get it. And they saw that the elderly population didn't convert with the flu vaccine as well. So they saw a spike in the adult population death and hospitalization, and went back to covering the pediatric population, covering the adult population, and those in between they didn't have any recommendation, but they suggested it. We saw that this season, it was the busiest since 2015-16 season, with sheer numbers. And I suspect that's what's going to happen next year. So yeah, we have to try to push it to the pediatric population. Those who want to get it should get it. Those who are at risk should get it. Anybody who is in commercial sales or doing any public health or in sales or any of that situation, it's key to try to cover it. I suspect the same may happen with COVID, although it may not be quite as dramatic, because the flu, it's a brand new usual mix of virus. So that's all. And as you know, the flu recommendations were delayed about, I think it was 6 or 8 weeks from the CDC. The World Health Organization gave the recommendation. Typically the following Tuesday when the CDC vaccine recommendation task force would meet, they would follow the World Health Organization recommendations because they have a broader exposure to what is likely going to be the flu strains that year. They delayed 2 of the meetings, so it occurred, but it occurred about a month and a half, 2 months late. So I'm not sure we're going to see the flu production and delivery. It may not be on time this year, which is going to be another concern. In addition, whether or not the subsidies will be there.
Yeah, that's concerning.
And you know,
We usually scramble, at the end, we have our clinics all scheduled and we're still waiting on vaccine. It's usually slow to arrive anyways, so I don't like to hear that.
yeah, I
know, if you-
agree. We oftentimes will have, the flu shows up in the big gigantic styrofoam boxes,
Mhm.
frozen, and there'll be 1,000 doses, and it'll be middle of September. It's like, well, that's a little bit late because the kids are back in school and you start to see the rise. And if you can imagine pushing back a month and a half, that's November, that's Thanksgiving, and that's that you're going to take a week or two to convert, and that's pushing it back, I think, too far. But we'll see. In addition to the cost, I mean, you mentioned the cost. The commercial cost of these is probably $100, and that's if you've got a family, you got 5 people in the family, that's $500. That's it's not a a small amount of money.
Right.
No.
I know. Scary times ahead.
Very scary.
It is very discouraging because at the highest level of the federal government, the recommendations have been at best marginally pushed for flu and now measles and COVID, and I suspect we're going to see another busy flu season next year. The measles, I mean, it's fairly simple to control a measles outbreak. Is you vaccinate everybody that's been exposed, and you've got 72 hours, so pretty much 3 days, to give a vaccine with a modified attenuated virus that will protect someone who's been exposed and not vaccinated. So the vaccine will keep them out of the hospital, will keep them from getting meningitis, keep them getting pneumonia, all the bad things. And it's just not as effective at the federal level that we've seen in the past. I don't mean to kind of beat this, but my mother was in New York City in 1947. There was, of all things, there was a smallpox outbreak, and the Board of Health in New York City delivered over 2 million doses of smallpox vaccine in about 2 weeks, and they got it in from different states and contained the outbreak of smallpox. The same thing could be done with the measles, and unfortunately, I suspect it will look like what it was pre-vaccination. You're going to see probably a year before the outbreak is contained, and that's going to be a lot of people sick.
Definitely.
I mean, I don't know if they, did go that path and it wasn't covered by insurance and whatnot. I don't know that we'd be able to sustain a vaccination program here, we don't have the funding for it on the local level without us being able to bill insurance, get that administration fee on top of that, roll that into an account and then next year purchase the vaccine with that money.
Right, that's the way it's operating now. We have a revolving account, so it's self-sustaining, but you have to get reimbursed, from all the Medicare stuff in order to be able to afford the next year's vaccine. So, yeah, could it be a monkey wrench in the whole thing?
I might be out of job.
So, I mean, so one option would be, we can see what happens in the next few months. And if we see kind of the catastrophe unfolding, what we could do is go to town meeting in the spring, or in the fall rather, and say we would like to get, pick a number, I don't know what, 1,000 vaccines at $100, well, that's gonna be a lot of money. Maybe we can get, 300 flu vaccines, and that'd be
Mhm.
30 grand from the town, and say we would like to get at least some level of free vaccines, and we'd have to pay it out of pocket. I don't know if anyone's willing to push that at town meeting, but that's one option.
Yeah.
Yep.
Yeah, I mean, we should be good with the amount of money we have now. We'll be good for this season. But yeah, for the following one, you're right. I might have to do that.
I mean, it's
Yeah.
not a ton of money, but it's, how much would we need? Well, if you want to do 20% of the town, that's going to be, 1,600 people. That's a lot. So we'd have to probably see what this season, this rollout over the next few months, what it looks like, and then approach the fall with probably having a potential warrant article on town meeting. It's not very common to see the Board of Health looking for, 50 grand.
And I guess the other question is, will insurance still cover these shots? Because I would assume, Joan, that the majority of the people that are getting the town vaccine are covered, either through Medicare or some other private insurance. I mean, I don't know how many uninsured people you actually vaccinate.
Not many, and
Yeah.
I don't turn anybody away if they come and they're,
Right, so
uninsured.
there is another avenue. I mean, I get my shots at CVS, and a lot of people do. So
Right,
the real question is, if people can't get the vaccine through the town, will they be able to get and pay for, or, a vaccine elsewhere? Will they still be getting vaccinated? And,
right.
if not, that's pretty serious. I mean, if we come to a point where insurance companies are going to stop covering these vaccinations, we're in big trouble.
Yeah,
Yep,
I would
absolutely.
agree. I mean, that would be, if the recommendations from the CDC say that, the flu, COVID, RSV, and all the other vaccines are recommended but not required, or have a less influential response, then the insurance companies may say it's fee for service for the vaccine, and that.
And they usually follow Medicare. I mean, insurance companies usually follow whatever Medicare does. So if it's not reimbursed by Medicare or covered by Medicare, then insurance companies will feel comfortable not covering them either. So that to me is the real crisis.
I'd agree. Yeah,
Yeah.
it is the Medicare umbrella covers a lot of supportive care and general treatment that we've covered, and allows the insurance companies not to balk at a lot of the just standard coverage. And you're right, that's going to be a problem if they walk away from it. That will be it's going to be a problem. Well, so much for doom and gloom.
Right?
Any other comments on that?
Well,
So-
I'd just like to reinforce the wonderful communications we've been getting from Robbie Goldstein. He's really been amazing. And, there was some good news earlier in the month that it looked like there was a stay on these, lawsuits, so that the funding would continue at least temporarily. But we'll see. I mean,
Yeah, I think you're right. I mean, day to day, things change, and if we can get through a certain length of time where there's some clarity, would be great.
Right, and we had heard good news last week about our, public health excellence grant, that most of the money was available. I think there's a CDC portion of it that might be a little shaky, but it sounded like the rest of it was all good to go. And even if we had to cut back a little bit, we'd still be okay, because we're only 3 small towns.
So we'll see how things transpire. If there's no more comment, we'll probably go on to the next item on the agenda. PHE grant, choose alternative for grant board. So Pam, I'll
Yeah,
let you
so-
take that.
So what that is, I'm sorry to interrupt you. So when we just signed that intermunicipal agreement, we talked about the structure of this like advisory committee. So it's basically the 3 voting members of the 3 health directors of Cohasset, Hingham, and Situate. But in order to have a quorum, we want to make sure that we have an alternate ready to go from each town. So we'd like to have Joan, who goes to all our PHE meetings, and she can be the alternate. So if I'm like out sick or something during a meeting, you know, we would have a quorum with her there. So the ask is that you would vote in Joan Taverna as the alternate for the PHE grant committee.
So I'd make a motion that we vote in Joan DeVerna as the alternate for the PHE grant.
Yep, I'll make a motion.
Second.
Yeah.
Motion's
Okay.
been seconded, and roll call vote. Marcia,
Marcy Lewis, I.
Paul Schubert, aye. The motion carries and is approved unanimously. Welcome, another Cohasset member on board. Excellent. So next up is the meeting minutes. Those are sent out on the previous email. So they are from the, let's see, the Tuesday, March 11th, 2025, Cohasset Board of Public Health minutes. Any discussion on it?
Nope.
So I'd ask for a motion for approval of the Tuesday, March 11th, 2025, Cohasset Board of Health minutes.
Yep, I'll make a motion to approve the minutes from the March 11th, 2025 Board of Health meeting.
And I will second that. Roll call vote. Marcia,
Marcy Lewis, I.
Paul Schubert, aye. The motion carries and is approved unanimously. Next up is next meeting date. So I think it's going to depend on, let me see, go back to the, so the May, I think the town election is the 17th. So you want to try to do it maybe on the 6th or the 13th, so we could potentially not have a problem with quorum?
Yeah, I can't do the 6th. I'm going to be away for 2 weeks. I'll be back I will be available on the 13th.
Will the 13th work with everyone?
Sure.
Okay, so let's tentatively book the 13th. We'll see if Elizabeth can make it. I think the town bylaws, I believe if there is no one that is either appointed or elected at the time, the current member may continue as a member unless there is someone appointed from the board of, from the select board. So we might be able to get by with, I'll have to check with Chris, we might be able to get by if she's willing to step in if there's a problem with quorum. So we'll set it for the,
She mentioned that. Yeah. So, we're trying to talk Mary
so May
Goodwin into
13th
doing
at
it.
6.
I was wondering about that. I thought about
Yeah.
that.
Because at this point, she could be a write-in candidate,
Yeah, good.
maybe.
Yeah, I was going to
I don't
ask.
know.
Yeah.
She didn't say no, but she didn't really say yes either. So we're working on it.
Yeah, at the end of the meeting, I
doc-
was going to ask if anyone had a recommendation for a write-in.
Yeah, and Dr. Schubert, if you see your neighbor, I'd, push her.
I think I'll do my best, yeah.
All
I
right.
think it only takes 10 votes or more than anyone else, so it doesn't take many for a write-in.
It doesn't take many. It's all you have to do is have the majority. You don't even have to have a minimum, according to the town clerk.
Oh, good, perfect.
Good.
So, well, let's see if we can find somebody. All right, I'll make some phone calls. And let me see, next up is Public Health Director report. Always.
Well, I don't have too much since my last report, but I would just say that the housing, I think, is gonna finally start picking up. We haven't really had too much action in the rental housing inspection program, but I finally had somebody reach out to me from the preserve, and we're gonna talk to them tomorrow. So I think if we can get that kicked off, then we'll have plenty of work. So I think it's good. I think we're getting there.
Excellent. And the Public Health nurse report is next.
Okay, so I really don't have a lot either. I was on vacation last week, so my focus this week is gonna be on, I've already reached out to the recreational camps. They're supposed to have their applications and all their, documentation and everything in the works 90 days prior to camp's opening, so it's getting close and I haven't received anything, so we'll focus on that this week, and then also on the whole flu order thing. I need to figure out what to do about that. I'm thinking of just cutting it down so we don't lose money, and then, you know, if it picks up, I guess I can always order some additional vaccine. That's always an option, so just a few things to think about. And then, like Pam said, I think this week we have a couple of inspections to do for the rental properties, so nothing big.
Yeah.
Excellent. Yeah, and I think in the fall, we can always approach the town for money if we need a refill of any of the vaccines, whether it's RSV or COVID or flu. But I think if we can push it from, Marcia was saying, if we can get everyone saying, look, tell your friends, neighbors, relatives, CVS is available until the, insurances start to balk, is probably the way to go.
Yeah, I think we'll be okay, like she said, for next year or this
Yeah.
upcoming season. I can't even believe we're already talking about it, but
I know.
and then we'll get the monies back from that. So we'll have additional money. So I think for a couple of seasons we'll be okay, but if it, like I said, if it goes down that road, we'd have to think differently.
So, if are there any other comments from any of the board members or anybody here?
No,
Okay. I don't have any topics reasonably anticipated 24 hours. I mentioned about the measles report from Texas, which was this morning or this afternoon. It looks like that will still be ongoing for probably another, I suspect, a year. In the past, it was a 3-year cycle, and it was kind of an interesting, the way measles hit, it would wipe through a community, and then it would take 3 years for enough young kids to come of age to be unvaccinated and unexposed to have another round of measles. So it had a very peculiar three-year cycle, hoping that, this will be a short 1-year cycle, but we'll see. So if there's
Yeah.
no, any other comments from anyone?
Nope.
So I'd ask for a motion to adjourn.
I'll make a motion to adjourn.
I'll second the motion and roll call vote. Marcia,
Marcia Lewis, aye.
Paul Schubert, aye, and it carries unanimously. We'll see you next month.
Great,
Stay healthy.
Okay.
right.
Thank you.
everyone.
See ya.
Bye.
Bye.